Hi everyone, welcome back to my channel. Today we're going to talk about some common sex therapy exercises, why they work and why they don't work. The first exercise that is very commonly recommended is called sensual focus. Sensual focus is an exercise in sex therapy that is also known as non-demand touch, sensate focus. It's actually one of the oldest exercises in the field, created by Masters and Johnson. Part of the reason why this is such a great exercise for sex therapy is it takes away the pressure around performance anxiety. It can take away the expectations, having a goal around sex. It also connects and bonds the couple by creating the exercise of touch as a pleasure activity in and of itself. In sex therapy, here's why I wouldn't recommend sensual focus. If a couple is very much in conflict, crisis, if they're dealing with relational trauma, sensual focus may feel like more pressure and expectation, and it may actually do more harm than good. It really depends on where the couple is in their relationship and what are some of the most important factors as to why they're in therapy. Most couples are dealing with things like desire discrepancies or difficulty communicating around sex. Sensual focus can be a great exercise for improving some of those areas, but also the readiness to do that work requires some healing, especially from past attachment wounding. Another exercise we recommend a lot in sex therapy is scheduling sex or scheduling a date night. I love this idea. It works for many couples, but it also doesn't work for many reasons. When it works, it helps prioritize that sex and dating is an important part of a relationship and that it shouldn't just happen. Planning and anticipating helps it become even more of a priority, and it also allows there to be more space around planning and anticipation so that it's not left last minute or put on the back burner to other areas in the day-to-day life. What's important about scheduling sex is that we want to make sure that if we are scheduling sex in a date night, that we know what's going to happen in that night. It's clear what's expected of one another. It's so important that we don't schedule a sexual date night and we don't talk about it beforehand and lead to disappointment or hurt feelings as a result of that. It's also important to remember that if you're scheduling sex in a date night, it doesn't always have to be that way. Sometimes we schedule just to get in a good rhythm, to make sure that it's a priority, that it's on the calendar like everything else in our lives. It can actually help improve sex and intimacy as a result. Here's why scheduling sex doesn't work. If we schedule sex, it can feel like an obligation and a chore, and it makes the person feel even more anxious and more worried about that encounter rather than feeling motivated and excited. Before I recommend scheduling sex in a relationship, I always look at the relational dynamics. If one partner is more of the low desire partner and feeling a lot of pressure around sex, a sex night or a date night is just going to feel like more pressure, and it actually may cause them to shut down, dissociate, or feel obligated around that activity. That's not fun for either partner, and it can lead to other issues like resentment or avoidance of sex overall. What's better to do is to help that couple find their way to each other. Desire is so individual. It's different for every single one of us. So if we find what works for that person, we want to help them start developing a sense of wanting and what does make them feel good. By developing things like bonding behaviors and ways for that couple to be intimate on a daily basis in ways that don't require a lot of time, energy, or focus, it can become more of a habit, and good habits lead to better behavior around sex and intimacy. Also, this common behavior is not something I recommend for every couple, and that's novelty and exploration. Sometimes there's a lot of shame and healing that's required before we start recommending things like sex toys, pleasure products, pornography, erotica. It's going to be different for everyone, and it's important to take into consideration that person's values, culture, and background. Sometimes that's not even necessary to create some novelty and excitement. Oftentimes it's just being creative and using your imagination in whatever way you feel comfortable. Let's remember, sexual fantasies are varied, so recommending something like a sex toy may just add another layer of pressure or make you feel in your head or create a mental barrier around feeling good. The most important thing to remember around sex therapy is that it is personalized personalized for every person. Not all things are going to work for everyone. We must take into consideration that sex therapy is about 3 relationships: your relationship with yourself, your relationship with your partner, and the relationship to the context of your understanding of sexuality. That includes everything from your arousal template, your interests, your desires, and remember, that's changing all the time. So even if we don't know what that is, that's a great place to start. There's only figuring out what works for you and developing sexual awareness that's only going to help improve sex overall. So I want to invite all you to be on your own personalized sexual health journey, and know that it's common to have concerns around sexuality, and it's also very common to seek help and get support like you would in sex therapy. If any of you have questions about common sex therapy exercises, recommendations, or if you should see a sex therapist, definitely leave me a comment. If you're new to my channel, hit that subscribe button, and I look forward to seeing you all in the next video.